Hello, my name is Anthony Longoria, like you said. I come from St. Edward's University in Texas, and this summer I conducted research through the SPUR Fellow Program at Hunter College. Today I investigated the effects of methamphetamine on memory, GLUA2, and IBA1 expression, so I'll be talking to you about that today. First of all, I want to go over methamphetamine and talk to you about why it's important to study it. First of all, it's a highly addictive substance that's prone to abuse. Approximately 12 million people have tried methamphetamine at least once in their life, and 1.2 million people tried it within the year leading up to a 2012 study. Meth is very dangerous. Meth users have an increased risk of Parkinson's disease, and brain-related research on the neurotoxic effects of meth show related inhibition of learning. So we're going to try to relate this learning to the effects of dangerous effects on Parkinson's disease and other degenerative disorders. So what we know right now is that methamphetamine impairs spatial learning. Meth destroys dopaminergic terminals in the striatum and hippocampus that are important for memory, and meth increases microglial levels and in turn indicates an inflammatory response. But what we are investigating for this experiment is it impairs long-term spatial memory retrieval. So rather than learning, memory ability to recall the information. And we are also looking to identify alterations in synaptic plasticity markers within specific hippocampal subregions. So my hypothesis for this study is that methamphetamine disrupts hippocampal-dependent long-term spatial memory. Meth decreases expression of synaptic markers important for memory, and meth increases markers of inflammation. To begin this process, we started with the behavioral analysis, which we used the radial 8-arm maze, which is a hippocampal-dependent learning task. So the mice were set up on a maze where 4 arms were baited, 4 arms were unbaited, and they relied on spatial cues to determine which arms had the food that the sweet mapo food, and they had to remember that during the 6 trials, which were the first 9 days of the behavioral component. So once they learned that, then we began the rest of our experiment. So the first 9 days, they had the learning task, and on day 10, they were injected with their first bolus dose of methamphetamine. A week later, they were injected with a second dose of methamphetamine. On day 24, which is a week after the second dose, they were tested on their ability to recall that learning task and remember which arms were baited, which arms were not baited. The next day, they were injected with their third dose of methamphetamine, and a week later, injected with the fourth dose. And the day after that, they were tested once again on their ability to remember their radial 8-arm maze. After that, the mice were then sacrificed, and their hippocampal tissue was analyzed to determine the molecular effects on synaptic markers. So the results from the behavioral study, focusing on the graph on the left, you can see that before the mice were injected with anything, during the first 9 days, they were trained on the radial 8-arm maze. You can see that both groups, before they were treated once again, increased their learning. So they started out getting about 40% of choosing the correct arm, but by the end of the training days, they were up to about 75%. So it shows that there was a significant increase in learning. So all groups learned. In the second graph on your right-hand side, you can see that the first test day, which is after they were injected with their first 2 doses of meth, both groups meth and saline groups performed about equivalently, no significant differences. However, the second test day on day 33, you can see that the mice that were injected with meth performed significantly worse than the mice that were injected with saline, and that shows that meth inhibited the learning and their memory from the first spatial learning task. So the second part of the experiment, we're looking at the anatomy and the specific subregions that were affected by methamphetamine, in particular immunohistochemistry. So as you can see here, on the left-hand side, there's a Nissl stain and the anatomy of a coronal section of the mouse brain. But in particular, we're going to be focusing on the hippocampus, which is this right here, and the subregions, stratum pyramidale, stratum lucidum, stratum radiatum, and stratum lacunosum moleculare, which are the ones highlighted right there. So for the immunohistochemistry analysis, we analyzed two synaptic markers. The first, GluA2, which is a memory marker, and AMPA receptor subunit. We then categorize these to small clusters and large clusters. We associate the small clusters with intact memory due to normal trafficking, trafficking of the AMPA receptor, and large clusters we associated with pathology, a disruption in the trafficking. With IBA1, you can see this mask right here. That's kind of the size criteria that we use. We associated higher levels of IBA1 with poor memory and with neuronal damage. The result from our immunohistochemistry, we see that meth reduces small GluA2 clusters in the CA3 SR and SLM subregions. So I want you to just focus on the graph on the left. You can see within the saline group, just the saline group, the mice that were trained, RAMs, they were trained, had an increase in small clusters of GluA2 compared to the mice that weren't trained. Now if you look at the other half of the graph, they also were significantly higher than the meth-treated animals. So the meth had lower amounts of small clusters, which small clusters we associated with normal learning and memory. On the second graph, you see that there's an overall treatment effect in the SLM region with small clusters again. So saline groups tended to have higher amounts of small clusters than the meth groups. We also see that meth increases the large GluA2 clusters in the CA3 SP subregion. So once again, there was an effect by treatment. The meth groups overall had higher amounts of large clusters than the saline groups, indicating the pathology disruption in the trafficking. With our IBA1 study, we see that meth increases IBA1 levels in the CA3, SP, and SLU subregions. There was an effect by treatment where the meth-treated animals had higher amounts of IBA1, which is a microglial marker, once again, and also we could see the similar effect in the SLU subregion. Overall, small GluA2 clusters increase with intact memory performance and are significantly lower after mice were injected with meth. Large GluA2 clusters increase after meth treatment associated with poor spatial memory. Last, meth increases IBA1 levels, indicating an inflammatory response that disrupts memory performance. So for future directions, NSAIDs, which are anti-inflammatory, we're looking to see if we could possibly use these to protect or remediate against meth neurotoxicity and associated memory deficits. So those are like your Tylenol, Advil, other types of anti-inflammatory medications. We also want to later examine the effects of meth on spine density and various spine types, because different neurons can be used for different processes in memory, and there's different types of memory. So we want to see specifically what types of spines are affected. Lastly, we want to examine the effects of oral administration of methamphetamine to resemble more of the human experience with meth addiction, rather than just injecting meth with bolus doses, seeing if we can get them addicted to meth, kind of more like a human would. So I'd like to thank my mentor, Dr. Peter Serrano, and my lab mates for helping me and for being there for me whenever I conducted my research, and the Hunter College and the Leadership Alliance for giving me the opportunity to conduct research here, and the grants that made it possible. Thank you.